perform a CPA or a central posterior to anterior pressure, you can start either from a superior level or inferior and work opposite. So if you started at the upper level, you can start at L1 and move down to L5, or vice versa, start at L5 and move up to L1. To do this, what you'll want to use is the aspect slightly distal to your pisiform, and you'll apply that pressure directly down through the spinous process in a directly anterior directed force. So pisiform, or slightly distal to the pisiform, will go there. Your body weight over top of the spinous process, and using your body to apply that P to A force, taking it to end range, looking to see if this reproduces a familiar symptom locally, or does it produce something in their familiar area of pain. You'll go down level by level, looking to see if it reproduces. After you've gone through each level, applying a CPA, if that has not reproduced their familiar symptom, the last step would be to do a UPA, or a unilateral posterior to anterior directed force, and that's going to be directed over the transverse process. To get to the transverse process, what we'll want to do is go back to the spinous process and go out about an inch or an inch and a half and apply again that same PA force. So again, the pisiform over the transverse process, an anteriorly directed force. And again, we're looking to see, does this reproduce their familiar symptoms if they're having back pain, or does this seem to refer down into their familiar area? It could be buttock, groin, or lateral hip. And same idea, we just want to clear every level, taking it to end range, springing a little bit. Typically, a unilateral PA will refer symptoms to that side. So if this is someone who's having right buttock pain, a right UPA tends to reproduce that symptom. It's unusual that a left UPA would reproduce a right-sided symptom.